Hello, today we're being joined by Evan Loevner, the owner of Aviva In-Home Care in San Francisco. Evan and his team help older adults stay safe, supported, and independent in their own homes through personalized caregiving services. Aviva works closely with families who are planning ahead, which makes this a valuable resource for clients of Von Rock Law. Evan, thank you for being here. How are you today?
Thank you, Dominic. I'm very well. Appreciate it.
Yeah, thanks again for joining us. Evan, for families who are trying to decide if in-home care is appropriate, what are some of the most common signs that it may be time to bring in support?
Yeah, sometimes it's obvious, Dominic, when there's a what I would call trigger event. It could be a fall that's resulted in some type of injury, whether it's a hip injury or an ankle. And those, of course, those in those events, we are jumping in for many times post-hospitalization support. So sometimes what we do is short in duration, can last a few weeks until the loved one recovers, or that might be the point at which we engage with folks on a regular basis. Other times, the decline can be somewhat less obvious or maybe more gradual. It might be a memory decline. It might be a case where someone is isolated and doesn't have family around them, and other families might want to bring in a home care agency to promote safety in the home and get this person more engaged in the community, take them out to things, get them to doctor's appointments, make sure that their hygiene is being kept up well. So there can be several entry points or, let's say, evidences that come up that would be a good point to think about care or start talking about care for someone in your family.
Yeah, and I guess it's important that when one of those trigger moments happen, to start thinking seriously about it and get some advice.
Yeah, actually, it's better to talk about it before that happens, right? Which most people don't. I think often people are making these decisions with their back up against the wall. So if there's any sign of the ill effects of aging, whether it's mobility is declining or, as I said, memory is starting to go down and that's manifesting in certain issues, it's often good to start engaging with community resources like caregiving agencies or geriatric care managers who can direct people to care agencies to understand what are the relationships that I do need to put in place should the need arise.
Sure. Can you explain what the onboarding process looks like for a new Aviva client, from the first phone call to matching a caregiver and starting care?
Mm-hmm. Well, I'm very much, Dominic, a person of giving out a lot of information, making sure that people are getting the best fit for what they need. We're a mature business; we've been around 12 years, so I want to make sure that if we take on a client, they feel good about it. We feel like it's the right match for us, because the last thing I want to have is our clients who are unhappy. So that being said, the upfront phone call can last anywhere from 2 minutes to 30 minutes, where I'm trying to give as much information about what we're about, how we approach things. The second step, as you mentioned, would be an onboarding meeting, so to speak, which is most often done in person, unless we're trying to rush things and need to get care in place by the next day, in which case we can get a lot of the necessary information on the phone. But the in-person meeting gives us a chance gives the family a chance to see who we are, what we're about, talk through things in greater detail, like what is the medical history of the client, what are the likes and dislikes, what is the typical behavior on a daily basis within the home, what are relevant aspects of that person's past, professionally or family-wise, that we should consider when we're in the home working with that person. Who is the family nearby? We get all the relative information concerning contacts and concerning key doctors' input and things like this that all need to be accounted for to create an optimal care plan. That's what we do when we sit down with the client, and that meeting, the client and their families rather, and that meeting can last anywhere from, I would say, minimally 1 hour to an hour and a half to an hour and 45 minutes. And we don't bill for that time. That's just part of our getting to know each other process and making sure that we feel good about moving forward.
Okay, that's good information to have. Now, a lot of Von Rock Law clients want to understand how quality and safety are maintained in the home. What systems does Aviva use to monitor care and ensure reliability?
I particularly like that question because I think that's one of the things that differentiates us as an agency. Uh, I'm an ex-hospital administrator, as Dominic, you and I have talked about, which I think has given me very much a process orientation. And when I started Aviva in 2014, one of the things I wanted to do was put a nurse director in place. So we had a clinician on board, which is very atypical for a non-medical care agency. In the US, I believe it's still the case, it was back then, and I believe it's still the case that only a minority of states mandate that you have a clinician on board involved in the operations. I always felt that that was remiss because even though we are handling non-medical care, we are all about preventing rehospitalization and preventing injury. So we are much more effective at doing that if we have a clinician involved in the oversight of care. So from day one, I've had a nurse director, as I mentioned. We also, very importantly, have a strategic partner who we've been working with for the last 4 or 5 years by the name of Honor Care. Honor is another organization that is at its heart both a technology and health organization. And we work in concert with them, joined at the hip, to serve every client. Honor brings a wealth of resources with them as a partner, one of which is a trust and safety team comprised of nurses, so that if there is a health setback, if there is any question as to whether we're following best practice with regards to doctor's orders, the nurses are making sure that we are in line with both of those things. Again, with health setbacks, we will adjust care plans as needed, and those will be orchestrated or crafted with us and the nurse team both involved. We're not going out and doing nursing care because we are not licensed for direct nurse intervention, such as wound care or physical therapy or occupational therapy. But having those clinical resources in the background enables us to do a much better job, a much higher quality job. Part of our daily practice, or excuse me, our, let's say, monthly practice as well, also relates directly to quality. We have 30, 60, and 90-day check-ins with every client at a minimum. Often I'm out there more often talking with clients directly and in their homes. But at a minimum, we are checking in on every client if they're in hospice, for example, every 30 days, if they've had any health setbacks, or they're working with home health organizations regularly because of medical need, strict medical need. We will go in and do a 60-day checkup, and at a minimum, we will do a 90-day checkup to make sure that our care plans are aligned with exactly what is needed for their care. And lastly, the way I'd end this answer to your question is our very structure also lends itself to quality control. Because of my partnership with Honor, this frees up a lot of my time on some of the back-end activity, things like recruiting good care professionals and so on, which Honor does an amazing job at, to go out and spend more time with clients and talking to them about their concerns and how they want care to evolve over time. So that in itself also lends itself to a higher quality operation.
Yeah, that sounds very comprehensive. That's quite unusual to have that approach.
It is pretty unique, yes.
And you've kind of answered my last question, but let me ask it anyway. There are many care providers in the Bay Area, but what would you say is the thing that makes Aviva in-home care unique?
Yeah. It is, a couple of things. Very much when you're small, relatively smaller organizations, which we still are, we're kind of in between that small and medium size with regards to home care. The owners and the management are very much the face of the business. So although we've grown over the last 12 years, I've been able to maintain my position as kind of the face of the business. And that means I inherently am very hands-on. Again, it's either myself or my right-hand gal, who's Hazel Weir. She's my client service director. We are the ones who are, to some extent, de facto care managers. We're not doing the same thing, the breadth of services that a geriatric care manager might provide, but we're doing a lot of similar activity in the home with our clients that we don't charge for. in terms of strategic direction, making sure the home is well stocked, answering certain questions that a care manager might typically be asked. We're able to give that what I'd call concierge style care precisely because we have that partnership with Honor. So it gives us the time to counsel families in that way. So that certainly makes us unique. And of course, the structure itself, as we alluded to, with the nursing involvement, with the trust and safety team, we're just able to deliver a higher level of care than most agencies and a higher level of service.
Perfect. Evan, that was really informative. Thank you very much. Thanks for sharing the insight, which is very, very valuable. For any Von Rock Law clients who are exploring in-home care for themselves or for a loved one, Aviva In-Home Care is a trusted option in San Francisco. You can reach out to Evan and his team to learn more about creating a safe and supportive plan at home. Contact details are scrolling away at the bottom of the screen. Evan, thanks once again for all of the information and insight, and hopefully we'll see you soon.
Thank you very much, Dominic. Appreciate the opportunity and great talking with you.
Take care. Bye-bye now.
Bye-bye.